So, more and more people are contracting this coronavirus all over the world. But what can you do to increase your chances of surviving? Well, before we go any further, I need to say this medical disclaimer. I'm not a doctor. This is not medical advice and I take no responsibility for your medical well-being. I'm only passing on information and giving you my opinion. If you are unwell, please seek qualified medical advice. With that said, let's take a look at what you can do. So, the UK NHS website says, wash your hands with soap and water often, do this for at least 20 seconds. Always wash your hands when you get home or into work. Use hand sanitizer gel if soap and water are not available. Cover your mouth and nose with a tissue or your sleeve, not your hands, when you cough or sneeze. Put used tissues in the bin immediately and wash your hands afterwards. Try to avoid close contact with people who are unwell. And do not touch your eyes, nose or mouth if your hands are not clean. In terms of nutritional advice, I saw this article by Alyse M. Hamilton, MD, and I hope I pronounced her name right. And she says, did you know that the coronavirus COVID-19 pandemic can be dramatically slowed and possibly even stopped with the immediate widespread use of very high doses of vitamin C? According to Dr. Thomas Levy, a board-certified cardiologist, attorney and world expert in high-dose vitamin C, for decades physicians have demonstrated the powerful antiviral action of vitamin C. So why don't we hear about this? TV news programmes that get most of their sales revenue from a constant barrage of drug company ads have not reported this effective and successful approach against viruses in general and coronavirus in particular. Likewise, Facebook is censoring proven information as misleading. Vitamin C can't be patented and is therefore not very interesting to big pharmaceutical companies. In China, doctors at ground zero of the COVID-19 virus are demonstrating with 3 ongoing clinical trials that high-dose vitamin C is being shown effective to slow and possibly ultimately stop the virus. What can we do here at home? It is critical to have a strong immune system to slow and stop viral and bacterial invaders. The immune system is made up of a network of cells, tissues and organs that work together to protect you. Your immune system is the front line of defense against infectious invaders. When activated by an invasion, the immune system attacks invading bacteria, viruses and parasites that cause disease or infection. In his book, Primal Panacea, Dr. Levy proclaims that vitamin C has been proven to strengthen your immune system at 20 different levels. Patients with viral infections quickly use up their protective vitamin C. Infected patients should consider immediate treatment with high doses of vitamin C, oral and/or intravenous. Sadly, for decades, medical doctors have been misled by a flawed study that high-dose vitamin C can cause kidney stones. According to Dr. Levy, this is simply not true for almost everyone. Dr. Ron Hunninghake, MD, medical director of the world-famous Riordan Clinic in Kansas, has performed tens of thousands of high-dose vitamin C infusions on his patients. He claims that over decades, only 1 stone has ever been seen in his clinic. Dr. Hunninghake said that with the many thousands of high-dose vitamin C IVs, up to 300,000 milligrams per IV, yes, you read that right, we should be the kidney stone capital of the world. We are simply not. If you don't have access to IV vitamin C, the physicians on the Orthomolecular Medicine News Service Review Board specifically recommend starting with at least 3,000 milligrams or more of oral vitamin C daily. Orally, take divided doses of 1,000 milligrams each in the morning, afternoon and night. This can be increased over time. Vitamin C empowers the immune system and can directly kill many viruses. It can be taken as sodium sorbate, which is non-acidic. To be most effective, it should be taken to bowel tolerance. This means taking high doses several or many times each day until you feel queasy in your gut, then back down the dose a bit. In addition to vitamin C, magnesium, vitamin D and others are also important to be taken by most of us. Unlike most drugs, vitamins never work well alone. It's easier to prevent an infection than to treat it when it becomes a severe illness. The following inexpensive supplements and dosing are recommended for adults as noted. Magnesium. Take 400 mg daily. Because modern farming and food processing remove magnesium, most of us are deficient. Magnesium is an extremely important nutrient critical for hundreds of biochemical processes in your body. Inexpensive and very valuable for acute infections, especially viral, oral magnesium citrate should be taken to bowel tolerance in divided dosages. Vitamin D3. Take 2,000 international units daily. Start with 5,000 international units a day for 2 weeks, then reduce to 2,000. Vitamin D is stored in the body for long periods but takes a while to reach an effective level. If you are deficient, especially living in colder climes in the winter, start by taking the larger dose for 2 weeks to build up the level quickly. The adult maintenance dose varies with body weight and is usually 2,000 to 5,000 international units a day. And in micrograms, that's 50 to 125 micrograms. Zinc. Shown to be effective in helping the body fight infections. A recommended dose is 20 to 40 milligrams per day for adults. Selenium, 100 micrograms daily, is an essential nutrient to help fight infections. B-complex vitamins and vitamin A. A multivitamin tablet with each meal will supply these conveniently and economically. Take and treat serious illnesses seriously. Never hesitate to seek medical attention if you are not sure. Vitamin C and the other above nutrients can be used along with your medicines when they are indicated from your primary care doctor or nurse practitioner. The physicians or providers who practice integrative and holistic medicine urge everyone to have a nutrient-based method to prevent or minimize symptoms for future viral infection. Nutritional supplements are not just a good idea, for fighting viruses they are absolutely essential. And the thing is, the amounts recommended for each of the nutrients here is not ridiculous. It's still within the safe limits for most people. Vitamins and minerals are not the problem. As Andrew Saul said in one of his articles back in December for the Orthomolecular Medicine News Service, no deaths from vitamins, none. Supplement safety confirmed by America's largest database. The 36th annual report from the American Association of Poison Control Centers shows 0 deaths from any vitamin. But wait, there's more. It shows no deaths from any dietary mineral supplement. There were no fatalities from amino acids. There were no deaths from herbs. Throughout the entire year, coast to coast across the entire USA, there was not one single death from a vitamin, mineral, or any other nutritional supplement. If supplements are allegedly so dangerous as the FDA, the news media, and even some physicians still claim, then where are the bodies? And yet, people are dying from the COVID-19 coronavirus.